Welcome to Your Health. I'm Melinda Meza, and today we have Dr. Walter Tom joining us. Dr. Tom, you have been here in Sonoma County for some time now. Tell us about yourself.
Thank you, Melinda. Yes, I've been here since, I can't believe it, 1986. I actually originally came here to be a kidney transplant surgeon, starting a transplant program in Santa Rosa Memorial Hospital. But about 11 years ago, I recreated myself when I was 45, and I really was just amazed at the technology that's occurring in cosmetic surgery, and that sort of drew me to that wonderful field that I've been now really enjoying for the last decade.
And you're at Aesthetic Laser and Vein Center. You have Santa Rosa and Napa, and you guys are doing a lot of advanced treatments there. But we'll backtrack. You don't look 40. You don't look like you're a day over 45, Dr. Tom.
Well, thank you. I appreciate that.
So tell us about some of the exciting things you're doing there.
Well, I think what's really exciting for me is that when I decided to open up a cosmetic surgery practice, there are a lot of good plastic surgeons in town. I thought, why would they want to come to see Dr. Tom? So my niche, I decided, Melinda, was that I really wanted to look at procedures that could only be done under local anesthesia. I think that's really the key. Patients really don't want to go to sleep anymore, Melinda. They want to have a procedure, be able to get up right away and carry on with their life. So we kept on adding one procedure after another, initially starting off with varicose veins under local anesthesia, which is great for the patient, going on to laser liposuction, now doing breast augmentations under local anesthesia, believe it or not, both placing the implant on top of the muscle as well as below the muscle. And most recently, what I'm very excited about is actually tummy tucks completely under local anesthesia.
I understand a lot of women who just had a baby need this mommy makeover, perhaps the tummy tuck or the breast augmentation. It's a lot safer with general anesthesia?
I believe that it is. First of all, let me just say, I have a lot of friends who are anesthesiologists, that general anesthesia can be very safe.
Right.
However, if you look at the statistics and in terms of recovery time, patients do better if you can perform a procedure under local anesthesia.
And I understand, looking at this video right now, this one patient, she was able to say, Dr. Tom, I would like my breasts a little bigger or a little smaller. When you're awake like that, you get to do that. That's amazing.
That's been a lot of fun, actually. And this is, to be clear for our viewers, that it's with saline implants. Because what we do is we put the implant in underneath the breast, and then we put saline or salt water to fill the implant up. So the manufacturer makes the implants where we can probably increase the volume of that implant up to about 10%. So what's really great is that we're actually able, while the patient's awake, to fill it up to their desired size. And then afterwards, for the patient, we can sit them up and say, do you like the size? Or, Jill, would you like to have it a little bit larger? And we can actually fill it up, Melinda, make the implant larger, and they can, with the mirror, decide on whether they like it a little bit larger or they want to go back to the original size that they selected.
That is amazing. And tell me more about the tummy tucks now.
I'm very excited about this. Laser liposuction, which I've been doing now for the last 4 years, introducing it as the first surgeon to Northern California for smart lipo, has been great. Under local anesthesia, through just tiny little needle punctures, placing a laser under the skin, heating up the skin, melting the fat, suctioning out the fat, we got very nice results. We got some nice skin tightening and very nice contouring for our patients. However, there were still those patients whose skin was very loose, and so even in those patients, the laser was not going to tighten up the skin a lot. So we researched, looked at the different techniques, the different ways of doing tummy tucks, and we've now brought to Santa Rosa an actual technique where we really do a full-blown tummy tuck completely under local. And what we do, again, is after anesthetizing the patient's area of concern, we will still laser the skin, laser the fat, suction out the excess fat, and then we're able to basically nip, tuck away, if you will, the excess skin, and all under local anesthesia, and the patient's talking to us. It's really a great technique.
Amazing results. You can see the results here. Just amazing what you're doing here, right here in the North Bay. It's not just for Hollywood. It's Dr. Tom with Aesthetic Laser and Vein Center here in the North Bay. I'm Melinda Meza.